Well, I was 12 years old, and I was babysitting for a favorite aunt, my father's sister, who was a single parent and was working, and so I stayed with them for the summer in Plainfield, Indiana. And it was that summer that she was working out in the yard a lot and started breaking out from the sun, and went to the doctor. And I remember the evening that she came home. I even remember what I fixed for dinner that night. But we were sitting around the table, and she had a patch on her chest. And at that time, that's how they tested for lupus. They drilled into the bone marrow, and that was the thinnest skin, no muscle there, and she had a patch on her chest, and they had tested her for lupus, and sure enough, she did have lupus. That was the first I had heard that the disease even existed. I actually have that aunt who subsequently passed away from lupus, unfortunately. Her sister, my other aunt, my father's second sister, has lupus as well. Two of her daughters have lupus, and then I have actually two sisters that have lupus. My older sister, who's 2 years older than me, was diagnosed with lupus years ago, and is really in pretty bad shape because of it. Hers is cutaneous. It's on the skin, but it's systemic as well. And then my younger sister has been diagnosed with lupus as well, and fortunately hers was diagnosed very early, and she seems to be doing very well right now.
About it.
Well, if you have a friend or a family member that has lupus, I think the thing to keep in mind is, the symptoms are different from patient to patient, but the symptoms are also different with each patient on a day-to-day basis. And so they have to learn with the symptoms, but I think it's important that family members and friends learn to live with their symptoms as well. And, recognizing the fact that some days they'll be extremely fatigued, and some days their joints will be extremely swollen and very painful, but the next day they might be all right. And so they're not faking, and I know that it's hard. We've had, actually there was an employee in the Senate who had lupus, and it was hard for people to understand that she would feel good one day and the next day she wouldn't. So I would say that would be what I would ask people to remember. I was pleased to be asked to be part of the walk. Obviously lupus is something that has affected my life, and I just hope that we'll get a great attendance at the walk. I hope that it will bring about, obviously, our hope is that someday we'll have not only a better treatment, but a better way to diagnose and maybe a cure one day.